Hey guys, GWS here. We need to have a talk. And just so you can briefly see what spawned this talk that we're going to have, it's Karen has public nervous breakdown over wearing a mask full video. Right? Now, because of the like to dislike ratio of this video being so high and Review Tech USA being so prominent, and because there is a lot of irrational shit being spread about COVID-19. So, two things I want to preface this video with. Number one, every single thing in this video I'm going to mention is from an authoritative source. There's no misinformation, so YouTube, Twitter, wherever this ends up, this is all sourced either from the government, usually from the government, or from an indirect source of the government, or from an authoritative source like the WHO. So, let's first of all break down what the statistics are and what is well cited. And we're going to go over what we can take away from all this. So here is Worldometer. This is where very common place to get statistics. Worldometer gets their information. I believe it's from Johns Hopkins. But correct me if I'm wrong, but they have medical sources for this information, including state and local information. Right, so we got 26 and a half million plus cases, and then you got 876,000 deaths, and then you have 18.7 million recovered. Okay, and as you can see, here's the active and closed cases. There's 7 million active, 19 million closed. Closed is either recovered or resulted in a death. Okay, so we got that. Here's the two graphics, both here's cases and deaths, and you could look at this either in the daily, you could look at it as a linear function, which is exponential, but it's kind of gotten linear over time, which is what you'd expect from a logistic curve. We'll get over that. And here's the logarithmic curve, which is kind of flattened out. See, from a pandemic that's growing, what you'd expect from a logarithmic curve is a straight line, because as you can see, it goes by power. Like, a log curve is where it goes up by 1 order of magnitude per data point. So you have the next data point's 10,000, the next is 100,000, the next is 1,000,000, the next is 10 million. Okay, and the reason that's important is because a logarithmic plot is a measure of exponentiation. So if the logarithmic curve were a straight line, that would mean that it follows a very specific exponential. Whereas if you have something like this, the amount of exponential increase is decreasing. And I understand a lot of this is going to be technical, but you're going to have to kind of deal with it, because in order to talk about the fundamentals, we're going to have to talk about the complexity. So here's the deaths. The deaths way more linear, which means the logarithmic flattens out like you'd expect. In fact, this is basically just a log x function. So basically the deaths are linear. A lot of this doesn't mean it, but I'm just trying to give all the information that I can. And here's, I don't think I got all the columns selected. Let's select some. I'm not going to go that. Okay. Here's deaths per million, total tests per million. We'll get into testing in another spot. We're not going to use this for testing. And we'll get rid of that one, obviously. Um, you know, it's like, okay, so if we go by raw number of cases, the United States is by far number one. And we're actually on a pretty good pace. Yesterday we had 44,000. And then we have 191,000 total deaths. But right now yesterday we had 1,094. So the deaths aren't really going down, but they're not necessarily going up. And, excuse me, a lot of that's a lagging indicator. I gotta go here. So we're going to look at the United States in particular, because this is what Review Tech USA is looking at. So, couple things to note and to understand. Yes, the United States has a lot of cases, but it also has a lot of people. The United States is the fourth most populated nation on the planet in terms of recorded population. So, yeah, we're naturally going to have a lot of places. And in addition, the United States has the number one economy in the world still, if you go by GDP, which is basically, it holds its water internationally, as opposed to something like PPP, where China has passed us. But that doesn't say a lot, but we're not going to get into an economic argument. So GDP, the United States is number one. So we're very highly visited and traded with country, with a lot of people. We're going to have a lot of cases. So this hysteria about the number of cases is just absurd. It is an absurdity. In fact, if you look at cases per million, we rank number 10, right? And a lot of these are in different combinations of more or less knockdown. Like, Qatar didn't have a large lockdown. I don't know about some of these, but I know Peru had a super harsh lockdown, and it did very little for theirs. Let's look at yesterday, actually. No, we're going by per million. Okay. So yeah, the same ranking. You got Peru right here, which was a super lockdown area. And a lot of those islands, too. Now, a lot of these islands, this is another part of the argument, because they are very highly traveled, visited islands. So you got a lot of people going through there compared to the population. So naturally, you're going to get more. But it's like, the amount of lockdown does not have a lot to do with the number of cases. So if you look at deaths, you look at deaths per million, we're also ranked number 10. And this is a little bit of a misleading statistic too, but even at face value, if you look at it, like, you'll hear people say, we have 191,000 deaths. We're doing horribly with COVID. We are doing absolutely awful. Yet if you look at deaths per million, look at who's there. Again, there's Peru, there's Spain, there's the UK, there's Chile, there's Italy, and there's Brazil. You know, very large, developed nations are above us in deaths per million. Even if we take that stat at face value, right? But it becomes even worse for those making this argument when you look at the case fatality rate. And see, Johns Hopkins actually keeps track of case fatality rate. Um, but a lot of other places will not report case fatality rate because, um, as you're about to see, here's the U.S. Look what happens when we look at case fatality. The United States is not here, not here, not here, not here, not here. We are way down here in case fatality rate. 3.0% of confirmed cases end in deaths. And see, even this isn't perfect because if you look at the actual death rates estimated from COVID, which includes all the asymptomatic cases that are not being tested, and I can actually show you that too. And I will show you that. But this case fatality rate, we are in the middle of the pack in case fatality. In fact, I think we might be slightly better than average. But either way, it's like, you look at these countries that are way up here. Italy again, United Kingdom, Belgium, Mexico, France. I guess you could put Hungary in there. They're pretty developed. Netherlands, Sweden, Canada. Then you got Ireland, you got Spain, you got Iran. Lots of huge, developed, big countries. Even China's somehow on this list. And China is very deceptive with their statistics. They've been caught trying to cover up pandemics, and in fact, with this particular pandemic, they had the guy who whistle blew on it arrested. So, not exactly an honest country, but yet even they're still worse than we are in case fatality. But yeah, you look at a lot of these nations that are worse than us in case fatality rate, significantly worse, 1.5 times, as in even like Germany, which is the, I believe, 5th largest economy, or 4th, they're still significantly higher than us. So, I guess the point I'm trying to illustrate here is that the United States is not as bad off as people are getting spooked about. Right? But you're going to learn in a second that this pandemic has been mismanaged by the entire world. Today, it continues, but even back when it started, there were multiple irresponsible statements made by multiple actors, many of them considered national heroes, like Andrew Cuomo. But you've also had, you've had Cuomo, you've had Vox, you've had other entities, at first downplaying COVID, saying it's just the flu, you could go out, you could do this, you could do that. But, and then, even the WHO and the CDC initially saying don't wear masks and do wear masks. You need to protect the stockpile by not buying masks, and then you need to buy masks, and it's been all over the place with this. But we can even just prove now that this thing has been mismanaged, and we're going to go to, let's go to this one right here. Now, here's the characteristics of people who died from COVID-19. And most of this isn't particularly important because this goes a lot into racial discussions. I'm not going to get into that in specific. But if you look at the median age of death, and it breaks it all the others down too. So here's all the ages. I'll just scroll down in this repeatedly because this goes into by race as well. And so if you look at the median age of death here, median age of death from COVID-19 is 78 years old, and it even has a range here between 67 and 87 is kind of the range that we're looking at. And this is 52,000 case-based surveillances. And here's supplemental surveillance, and the median age of death is 75, between 64 and 84 here. And so, as you're going to start to see, the people who are getting this and dying, it's not young people, right? And you're going to see that here. Okay, this is from the American Council on Science and Health up here. And coronavirus COVID deaths in the U.S. by age and race. We're not looking at race, we're just looking at age. I may scroll down and show you the age stuff. But, you know, what's important to realize is this. Look at these ages. Under 1 year old, less than 0.08% have died. 1 to 4 years, a little bit more just because, well, it's a larger range, 0.005%. And then you have about 0.01% of all COVID deaths. And we're going to get into the death rate here in a second. But I just want to give you the age breakdown and explain how this is being mismanaged. So we got 0.01% between 5 and 14. That's all COVID deaths. 15 to 24, you have 0.0000, or about 0.1%. And then you got about 0.5% of all COVID deaths between 25 and 34. So as you see, the only time we get into significant numbers is when we get to people basically over 70 years old. That's where... So it's not just the elderly. It's not just like people, 65 years old, right? This only hits dramatically hard when basically you're over 70. And one stat I don't have, unfortunately, is the comorbidity rate. I've heard it's high, but I'm not going to use it as an argument because I don't have the stats on it. I think they're somewhere, but I did not prepare for that in the case of making in this video. So we're not going to use that. But just know there's some percentage of people who die who have what's called comorbidities, which is they die from more than one thing. So, like, for example, you have an older person who has, heart disease or something, and then they catch COVID, and it basically kills them because it wreaks havoc with their heart, or just the pneumonia causes complications, and that causes some kind of heart failure, right? So you have that. But even not looking at comorbidities, and again, this goes with the stat that I just shared with you, is that basically 60%, just under 60%, of people who die from COVID are over 75 years old, according to this. And more importantly, over 90% of people who die are over the age, are 55 and over. Okay, and here's another kind of way to look at this. We'll take the total slice. So this is because people talk about how the numbers are underestimated, overestimated from COVID. a very good and underrated stat to look at is basically total deaths and what's gone up, what's gone down from both expected, and how much of the total deaths does COVID-19 cause or contribute to. This isn't completely that, but it's very close to that statistic. And I don't know of good data that's recent in terms of excess death. So we're going to go with this because it's neatly presented. And as you can see, even with people 85 or over, like the absolute highest group, 85 and over, it's only spiked those deaths by just less than 10%. So you have your deaths here, 360,000 total deaths, only 34,000 of them. I believe this is U.S. deaths, so only 34,000 of them are caused by COVID. Again, not even taking into account the comorbidities. And actually, a higher percentage, between 75 and 84, die from COVID. You had 283,000, about 284,000 total died between 75 and 84, and 27,500 are from COVID. Okay, so here's the point I'm trying to make. It's a little bit long-winded. I'll just scroll down the race stuff in case you care, which I don't, but so actually here's an interesting one that I didn't even notice. I didn't even scroll down this far. This is the infection. This is basically the case fatality rate by age. And this is another actual good thing. Like, the estimated total fatality rate is 0.6%, which falls within the range I'm going to show and what I'm going to try to show. It's very close to that. But also, let's remember that a lot of these deaths that happened were early on, between March and May, when the treatments weren't as good and the virus and its impacts weren't as well understood. We're getting a better and better picture of the virus by the day, by the week. So even for 65 people and over, the mortality rate is only estimated to be about 6%. Right? And that's, again, the most at-risk group. So we're going to go ahead and go to our final piece of data here. I hope I have it bookmarked. If I don't, I'm going to have to go to it. Okay, here it is. Corona death rate. Okay, I guess I'll accept your little cookies. How deadly is coronavirus? Okay, let's have a look here if I can. Okay, so here it is. Basically, the studies I have any faith in are trending to converge on 0.5% to 1% fatality rate. And this article is actually a little bit dated. This is from June, which seems like an eternity ago, to be honest. But yeah, 0.5% to 1% death rate. Now let's see if I can find the CDC's. I don't have that bookmarked. I want to see if I can go on a little Google adventure here. Okay, so we're going to get a few. This is updated in July, but I don't know if we're going to get a percentage. Let's see if we can't find something. Okay, so that's percentage that are asymptomatic infectiousness. I don't think this has the death rate, but let's look. Again, I'm having faith in numbers I have not really looked a lot into, but let me see if I can look up the estimate. Okay. You have to bear with me here. Let's contain the increase. You will have to bear with me. Testing positive. Okay, so that's positive testing. Clinical. So this is the amount that have it as a percentage. Right, and actually, I could even go into the total number of infected, including asymptomatic or just all untested cases. But I have a feeling a lot of that information is a little bit dated given the amount of testing we're doing. I don't even know if it's possible, based on the amount of testing that we've done, that 20 times more people have tested positive than have the virus, but I'm not sure. Based on a certificate data percentage of deaths that come pneumonia influenza. Okay, this is the total mortality. That's not anything to do with this. Okay, I'm not entirely sure. I'm not entirely sure how to find it. I want to find this. Let's see. Let's see if I can. Okay, CDC COVID-19 death rate. Okay, we've looked at that one. I know there's data here that says that their estimates are between... Okay, here we go. This one's probably the best we're gonna get. Okay, so here we go. CDC estimates COVID-19 death rate around 0.26%, but doesn't confirm it. So this is basically a media fact check. But the point is that they're saying that's the estimate, and that's just what we're looking for here. We don't need the confirmation. So of course, USA Today is going to fact check it as false, but the reality is that was their estimate, around 0.26%. So the point I'm making is to understand the data, we got to look at this data from all perspectives. So let's summarize what we've confirmed. Number one, half of all deaths are over either 78 or 75, as confirmed by this link right here. Okay, over half it's at least 75. In fact, this says 60% over 75. Okay, and then 90% above 54. So when you're talking about parents and kids regarding school, 10% of all deaths are under 55, combined with the fact that the overall mortality rate is about either between 0.5 and 1%, or probably, because it's the most recent one, the CDC's estimate of 0.26%. But even if we were to give a 0.5% or even 0.75%, here is basically, these are your parents right here, between 20 and 49 years old, most of them. Even if you look at between 50 and 64, the estimated fatality rate, the IFR, you have 9 thousandths of a percent. That's not a typo. That's 9 thousandths of a percent. Not even 100th of a percent. So if you're looking at everybody under the age of 64, according to this, it's about 0.15% chance of death. Again, these are your parents, these are your kids, these are the people that we are all fear-mongering. Wear your mask when you go to the store. You know, do this, do that, social distance, don't go out. Hair salons can't stay open. Don't go to funerals, don't go to church, don't go anywhere, except for protests. But let's not get into the hypocrisies here, right? Just know that they exist, but that's not the point of this video. The point is that we are all up in arms over this. About a 1500ths of a percent. Round it up if you want to 0.2%. I don't care. It's the same regardless. It is the exact same thing regardless. This is what we're all up in arms about. And for reference, I hear different things about the flu's rate, but even if it were like at the lowest end I've seen, about like 0.05%, you know, yeah, 4 times the death rate of the flu. You know, I mean, if you consider the mortality rate of the flu, yeah. Okay, but also consider the flu is also almost entirely killing older people. But no need to get into that. But the point I'm making is, we're all up in arms about that when you have states that have neglected their elderly, countries that have neglected their elderly. And so what we're looking at is, because we're doing this shotgun lockdown policy where the economy is disrupted and a lot of people lose access to key things that help them out in life and therefore make their lives more difficult, and thus in various ways will cause their own problems. And in fact, I think I can pull up another thing here. Yeah, I was looking up populations of countries, so there's a little bit of what GWS is up to. So let's look at let's see. Yeah, here we go, right here. Here's the, this is the Telegraph. This isn't, exactly, where's the, article? So I guess they're doing... Let's see if we can find something else here. Okay, this was the one I think I looked at before. Lockdown killed 2 people for every 3 that died of coronavirus. 16,000 people in the UK died in 5 weeks as hospitals shut down to deal with COVID, while 25,000 died of the virus. This was written 7th of August, so it's not horribly outdated. But let me look at their source. The source of this is, new government figures have revealed. So let's see if we can get specifics on which government. Scientific Advisory Group of the UK has estimated that the lockdown has killed 2 out of every 3 that have died of coronavirus. So this is concrete evidence of the fact that the lockdowns themselves are causing problems and causing people to die of various things, or at least being a cause, maybe an amplifying cause or whatnot of certain things like suicide, drug use, drinking, things people often do indoors that are unhealthy. And I don't think you could necessarily blame the lockdown for everything. People have to be responsible, but the reality is, like, if you could look at the externalities of those lockdowns and see them as imposing not only the direct cost of the economy, but indirect causes of problems that are a lot more difficult to spot and are a lot less intuitive because you're not directly connected with them. So we have that. We got a shotgun policy that targets everybody, the entire economy, instead of protecting those who are most vulnerable. That's a problem. And it's a huge problem, especially when you look at how these things have been done. And if you look at how the goalposts have moved since March, in March, I don't know if any of you remember, I'm not going to look this up, I'm just hoping there's some of you who remember. The original point was to slow the spread, to flatten the curve. And the point behind flattening the curve was a genuine concern that while COVID may not have a high death rate, it at the time had a high hospitalization rate, high enough to the point where potentially we couldn't properly care for everybody in hospitals. That was a legitimate concern at the time, especially with how little we knew about COVID-19 and the issues that it causes. And so, when you look at how that's evolved, from slowing the spread by flattening the curve. Now, if you look at flattening the curve does not reduce the area under the curve. The area under the curve is going to be the total number of people impacted, right? All it does is it widens the base so that the same number of people may get infected, but it's over a longer period of time where medical facilities could handle it. But the problem is, and I wish I had an illustration to make the math easier to understand is, like, you have a medical capacity that's like a pretty linear thing. Like, the medical capacity is what it is, and in fact it probably increases over time. So you could look at it as maybe having a slightly upward slope on a graph with respect to time. Your total medical capacity. Okay? That doesn't change with like the shape of the curve of infected coronavirus people. So what you're talking about is when you have a curve that is significantly flatter. It's so flat that we're not fully utilizing our medical facilities. What you're doing is you are causing many more of these externalities from the lockdowns over a longer period of time, because a lockdown's a lockdown, right? You're not going to have like that much of a difference between a lockdown policy and a not lockdown policy. You basically have three policies. You have mask, social distance. Well, you have nothing, of course. Do nothing. Then you have mask, social distance, and then you have stay-at-home order, only essential workers. Like, those are pretty much the three different. You could probably sneak a fourth one in there, but the point I'm trying to make is there's not a lot of flexibility in a lockdown, right? A lockdown is going to be a lockdown. So when you have this lockdown, when you may reach a fifth of medical capacity with the shape of the curve, and that is incredibly inefficient, and it's going to cause problems. So this is where the goalposts have shifted. We went from flattening the curve to we just have to prevent people from getting the virus, right? The fewer people infected, the better. So it went from, the goal is to flatten the curve by widening the base, to we just want to infect fewer people. That's it. The problem is that when you're talking about a mitigation strategy, like the whole mask, social distance, lockdown policy does not have that impact, right? You can't just magically change what that does to a curve. There's actually, in fact, I can actually go away from this trash video from Review Tech USA. Let's go. Yeah, let's look at. This is a very good video, released in early March, I believe it was. Yeah, well, it was late March, but it's in March. Talking about the spread of pandemics. This is a very good video. I encourage everybody to watch this because this gives the basic math behind all the numbers I've been showing you. Everything I've been showing you before this point looks at things from that perspective. So if you want to know what flattening the curve means, if you want to know what the logistical curve I was talking about early means, if you want to talk about widening the base of a curve, this video will show you everything that you need to know. Everything about COVID-19. Everything about what's been hitting us. And it's going to show you a lot of the math that I'm ready to get into with regarding masks, regarding the strategies. So when you're talking about strategies to combat a pandemic, you have two different strategies. You have what's called containment. Containment means everybody who's infected, you've properly quarantined them, there's no community spread, and you are in full control of the virus. The virus is fully 100% contained. It's like when they talk about a wildfire. When a wildfire is called contained, it means it's been isolated and it is no longer a threat to outside of the containment area. They have full containment, just means you have full control over what's going on and nothing is outside of your control. And then there is the strategy when containment is no longer feasible, which is called mitigation. Mitigation is an understanding that you have lost control of the virus, that it is fully within the community, the spread is unstoppable, and all you're trying to do is limit the damage the virus does. So things under containment would be cures, treatments, increased hospital capacity, in some situations, slowing the spread. Not in all situations. We're going to get into that. So, what we were talking about earlier, what they did in March, with the flattening of the curve, that was a mitigation strategy. That was when it started spreading unstoppably in New York. We won't get into why, but there was a certain de Blasio we could be talking about. But again, that's a separate topic. We're not getting into politics. But, you know, it starts spreading in New York, and then it kind of starts trickling around the country. And we basically completely lose control over everybody who has the virus. So at that point, like, you could no longer just quarantine people because it was spreading so quickly, and it was incubating within other people, and you couldn't get to everybody. So the whole slow the spread, flatten the curve thing was a mitigation strategy to prevent hospitals from being overwhelmed. And then you had the shift of the goalposts. So all of a sudden, we went from mitigation, which was a sensible policy, all the way back to containment. We want to get control of this virus, as in, we want to lower the numbers of people who have the virus. And this has never been how pandemics have been managed. You don't go from mitigation to containment. It goes the other way around. That's the way we've always done it. And here's the problem, okay? Now, if you watch this video, and I encourage you to watch at least part of this, maybe watch at the same time, there is a variable called R0, or R0, basically. R subscript 0, which is the number of people infected by a single person, right? And given no social distancing rules or any of that, you get to an R0 value of, I think it's around 6. It may even be a little bit higher because we're dealing with a mutated form ever since then. But let's just call it 6, right? So when you're talking about something like COVID-19, you're talking about any pandemic, rather, and you're basically trying to slow the spread. What you're doing, in effect, is lowering this R0 value. So instead of one person infecting every 6 people, you may get one person infecting every 2 people, right? Or maybe even 1.5 people. In order for a pandemic to go into permanent remission, you got to have an R0 value of beneath 1. That means one person is infecting less than one other person from with the pandemic. So what you're talking about is like you have the masks, which even if the masks, like even if we were to give the full benefit of the doubt, there is not a shred of evidence of this, by the way. Even if we were to give the benefit of the doubt, given the amount of people who've had the virus, and then you look at the impact that masks have, like even if all of that were to reduce the R0 value beneath 1, which is what you would need to do, the only problem is this only works if you do this until there's 0 people infected. Because here's the problem, like, once let's just say we're down to 5 cases per day that we're detecting. 5 cases per day, whatever the amount of deaths, but just 5 cases per day. And you say, okay, let's remove the lockdown. And we're just going to go back to normal. Nobody's getting infected anymore. Okay, the problem is, immediately when you do that, that R0 value goes right back to where it was. So it goes right back to 6. So you'll have 5 people, they'll infect 6 people again, which will bring it up to 30. Then they'll infect 6 people again, which will bring it up to 180. And for a while, these numbers won't look bad. But the problem is you're going back to square one with the pandemic. And you're starting to see it in Europe, too. Those were the numbers I was, I believe I pointed them out. Let me, yeah, I'm pretty sure I pointed them out, where France went from very little cases, now they're up to 7,000 cases a day. Italy, after going down to nearly nothing, is up to about 1,500 cases. The UK is almost at 2,000 cases. And in fact, I think they might be over 2,000. Let's go ahead and look real quick. We're going to look at a few of these European nations that are said to be doing so great. I might not have went over this because I've went over so much material. Yeah, here we go. France went from 7,000 to about 9,000, and we still got 4 more hours in the day, folks. In the where it rolls over to the next day. And I believe it goes by universal when it does that. But anyhow, you have France, which is exploding in cases now. It's going to be over 10,000. For sure. Almost for sure today. Then you got the UK. They're still hanging at 1,940 like they were. They obviously haven't reported. You got 1,733 in Italy. You got 1,500 in Germany. These are the European nations that, the whole media is trumpeting as having conquered the virus. They haven't conquered the virus. Because the problem you're getting into is immediately, when you take away those lockdowns, when you start snapping back, when you stop wearing the mask, the moment you do those things that reduce that R0 value down to close to 1 or less than 1 or what have you, the moment you do that, the virus isn't just going to have mercy. Like, it's going to snap back. That's the way the math works. So, I guess to kind of close this out, if you can't rely on that, what can you rely on? And, another question to ask is this a sound policy? And there is one thing that would make a mitigation strategy a smart strategy. And that is for way number one of terminating the virus if we get a good vaccine for the virus. If we get a good vaccine for the virus, then the mitigation would have worked because, you just basically reduce everything to zero right away. Like, theoretically, if everybody takes the vaccine and there's no negative impacts and the vaccine is either 100% or close to 100% effective, then, that's that. Right? Is this redlining? No. But that's that. I think I am. I think I need to turn myself down a little. Just a little, yeah. Sorry if I've been loud, but, yeah, we're in a good spot now with the mic. So, anyhow, the mitigation strategy of flattening the curve, slowing the spread, only works if you get a vaccine. Right? Number one, we don't know when a vaccine is coming. And number two, we don't know if the vaccine is going to contain full immunity or partial immunity, a reduction in symptoms. We don't know what impact this vaccine is going to have or how much of an impact it's going to have. And so this is what I like to call praying to the vaccine gods. Because all you're doing is you're relying on faith, on blind faith, that they will pass these large-scale clinical trials and that they will be effective, and that they will be effective enough at, to lower the numbers to either nothing or virtually nothing, or lower the impact where the virus just can't do any damage. Okay, there's that, or there is the mathematical solution provided by 3 Blue 1 Brown and has been applied by other countries, and that is you have a focused mitigation strategy on the elderly, who are the most vulnerable, as in you have a super strict set of rules surrounding nursing homes, surrounding anybody who has an elderly as a dependent, or anybody like over 70. Maybe even over 65, I'd say. You have a specific policy for people who live with an elderly person. And then for everybody else, it's just a complete normal economy. Like no mask, no social distance, no occupancy limits, no limits on churches, etc. And if elderly people want to go out and they want to take that risk on their own free will, you give them that right too. But just make sure they understand the risk that they're taking, that if they get COVID-19, they have about a 5% chance of dying, right? That's, that needs to be communicated very clearly. But for everybody else, in terms of like living with them, that's basically how you do it. Like you have a focused mitigation strategy combined with the science of herd immunity, which is the science based on this video. I'm not talking about Anthony Fauci, who has made a lot of misstatements in this time. I'm talking just about the pure mathematics. The pure mathematics of a pandemic is that it goes on a logistical curve. So that's one benefit to that. And then I lost kind of my train of thought on exactly what I was gonna mention next. This has been a very long video, but I just wanted to be very comprehensive. Make sure you understand the data. Make sure you understand the pros and cons of both the flatten the curve strategy, which works if you're talking about a vaccine, or the herd immunity strategy with focused mitigation for the elderly, which works just mathematically. Okay, because, like I said, the logistical curve is going to work naturally. And this is actually what I was going to talk about, is there is another problem with slowing the spread that we need to talk about. And it's actually in the research here. So we're going to look up yet another piece of research. This has been very, I hope you guys like this. This is very informative. But, let's see. Okay, here we go. Right here. There's one. This is CNBC. But, this comes from a study. And this is another problem with slowing the spread, and they're going to make me... Okay, continue to cite, because I've already done this. Okay. So, this is another big alarming thing about slowing the spread. And that is, if you have only 2 to 3 months of immunity, which this doesn't confirm that, because if the antibodies only last 2 to 3 months, like, you could still have things like T-cell immunity, which would handle the virus better. And given the fact that I don't know if there's evidence to support any large reemergences of the virus in people, there's possible evidence that the virus, you could get it more than once, but based on what I've read, and I don't have anything in particular to support this specific bit of information, so just keep that in mind. But from what I've read, like, even people who've caught it a second time, or who had flare-ups, whatever it is, they don't get severe symptoms again. So it's like it's like chickenpox. Like, you get it once, and then that's pretty much it. And then the rest, like anything else, is just minor. So, you got 2 to 3 months after infection that you could have. It's possible that, even if it's not 2 to 3 months, even if you're talking about something like 6 months, people have after infection. If you're looking at slowing the spread, you're looking at a potential that this could swing around a second time, not just to, like, areas that haven't been infected yet, but you could have complete resurgences of places that were hit early. People recovered, and then 6 months later people lost their immunity, and then now they're getting it again, and the cycle continues. Okay, that's not going to happen with herd immunity, because herd immunity relies on a fast spread among healthy people and protecting certain other groups. So this was the last point, because this is part of the key argument against the idea of flattening the curve, slowing the spread. Added to all the other arguments I've given. And like I said, there's only one good argument um, for slowing the spread, and that is praying for a vaccine. Like I said, referred to it earlier, praying to the vaccine gods, because that's what it is. Because you're basically having blind faith that something's going to come out that may not come out or may not be effective, or worst case scenario, may be nearly as harmful as the virus itself. And that's really the final point I could give on this. So the bottom line is the TLDR of the whole thing is, number one, the numbers given about the United States are entirely misrepresentative of the impact of the pandemic. When you look at cases per million, deaths per million, and case fatality rate, the numbers have been greatly exaggerated. In addition, there is misinformation by the media in terms of the danger this imposes to young people, right? And as I pointed out in my data earlier in this video, for most people, you got maybe 0.15% chance of dying, not significantly higher than the flu, especially if you look at the flu's already low death rate. Like, if you triple the murder rate of a large city that gets one death per year, you get 3 deaths, but in actuality, the impact is minimal, and that's kind of what it is with this. Like, you could say COVID has tripled the death rate of the flu, even in people under 65. You could say that, but you're tripling a tiny number. 3 times 0 is still 0, no matter how you look at it. So that's sensationalized. And of course, politically, this is sensationalized, but you could look to other videos for how that's true. But basically, this is no particular president's fault. Like, because number one, of course, the numbers aren't even that bad for the United States in particular. And Europe, all this stuff touted about Europe, they're doing, in many metrics, worse than we are. Or, in the best of cases, not significantly better. Virus is not gone in Europe. It's not under control in Europe. There are almost no places in the world that have containment over the virus. And those that do have containment, the very few, are countries with very small populations that are isolated nations that don't get many visitors. And so they were able to lock down. Like New Zealand is one of the very few exceptions of a nation that seems, and I say that very timidly, New Zealand seems to have contained the virus. In fact, let's do something bonus. Let's look at New Zealand's numbers, because we're being thorough here. They actually had a death yesterday, but they're getting +5 cases. So yeah, they only ever had 1,700. So they were within containment. But when you're looking at most countries are not New Zealand. Right? All these places, even places that are only getting 40, 50 cases, right? It's not, that doesn't make it under control. And the problem, the more general problem we're facing is a culture of fear. And this is unfortunately something That's just primal to humans, but we should be better than this in 2020. Allowing fear to cloud our judgment over something. Not even a legitimate fear, because, like all aspects of humanity, you know, our animistic instincts do have uses. But fear based on trumped up things said by an irresponsible media, said by irresponsible people who want to be judgmental and control others' lives. This does not help. Like, we need to be data driven and understanding, and not use data for sensationalism, because that's what's really being done. Is when you look at just the raw number of which nation has the most cases or the most deaths, with no other context. No context over the population of the country, the population density of the country, the demographics of the country, the specific situation of the country, the largest of the economy, how many visitors the country has. You have a lot of things. Like, when you're just using statistics disingenuously to trump up fear for political reasons or sometimes even for personal reasons, that's the problem we're facing. And let me tell you this, folks, this is going to take us to a dark area in our history where the rational faculties of humanity are going to be overridden by the ideological extremism of humanity. And we have to stop fear-mongering, and we have to stop. And if somebody disagrees with me, I'm very, very, very open to debating you in the comments or in a live stream or wherever you want to debate over the specific numbers that have been given in this video. The specific authoritative information. 95% of these statements that I've made in this video have been covered by authoritative sources, government sources, and when they have not, I've said they have not. But it's rare, and I only make general things about stuff that doesn't come from authoritative sources, because I do want to have an honest, full, comprehensive debate over the data. A rational debate over the data. And the data is key, because the sensationalism is going to do nothing but break this world apart, and everything that you treasure, your iPhones, your computers, your homes, your Alexas, everything is going to fall to pieces if you rely on this ideological extremism to form your opinions, if you fail to do your own research, if you fail to look at the numbers or understand the numbers or understand even the principle behind the numbers, because you don't need to understand everything about mathematics in order to understand the proper way to judge specific things that are being told. Basically, the bottom line I say about everything in life is be skeptical. Be skeptical of what the media says to you. Be skeptical of what you hear on Facebook. Be skeptical of the news articles you read. Be skeptical of everything. Start by questioning what they say, and then don't just look up something to confirm your previous beliefs. Look at things thoroughly from all sides, and look at the rational arguments for all sides, especially this one, especially COVID-19. Look at it from all sides. And then look at, more importantly, be charitable. Understand the arguments that both sides are making. Because if we don't start doing that, if people just want to be mentally lazy, then what you're going to get is you're going to reap what you sow. You're going to get a mentally lazy world that is not going to advance, that's not going to improve, that's not going to solve the problems, and that is going to devolve into a state of anarchy, into a state of tribalism. And if you want a world like that, if that's the world you want to live in, then continue to be lazy, continue to work your 9 to 5, continue not to question the things you read and hear because you're tired from your day of work and you think that you are absolved from that responsibility of being a thoughtful citizen of this country and of this world because of that fact, because you're disinterested. If you want a tribalistic world where your standard of living continues to fall apart around you and you want to keep asking why, then keep it up, because that's the world you're going to get. That is the world you're going to get if you don't start questioning. I don't want to live in that world. I don't think most people want to live in that world. And I think that's where I'll leave it. Thank you guys so much for listening, and God bless.